Assessment of personality, behavioral analysis. You might have noticed that you procrastinate more when you have a large workload or when you are feeling tired. Do you experience temporary relief from stress by avoiding the task? Or do you face negative consequences like last minute rush or poor quality of work? If you have observed this, then this is an example of analyzing your own behavior. Before going to the details, please remember to subscribe this channel if you are new here. Do watch other videos in this channel, share it with students and those who love learning psychology. Thank you. Assessment of personality is done through self-report measures, projective techniques and behavioral analysis. The first two, the self-report measure and the projective technique, we have seen in previous videos. In this video, we will learn what is behavioral analysis. Behavioral analysis is also known as behavior analysis or behavioral assessment. It is a systematic approach to understanding and predicting human behavior. It involves observation, measurement, and interpretation of behavior in order to gain insight into the underlying factors that influence individuals. The field of behavioral analysis encompasses various theories and methodologies, but it generally focuses on the relationship between an individual's behavior and the environmental events or stimuli that precede or follow it. By analyzing these relationships, behavioral analysts seek to identify patterns, predict future behavior, and develop strategies to modify or manage behavior. There are various ways to make inferences about one's personality through behavior. They are interview, observation, behavioral ratings, nomination, and situational test. Let's see each of these in detail. Interview. An interview in behavioral analysis typically conducted to gather information about the person's behavior, thought, feelings, and experience. Let's see an example. Assessing communication skill for a healthcare provider. The example question can be like this. Describe a situation where you had to deliver difficult news to a patient or their family. How did you approach the conversation and what strategies did you use to ensure effective communication? Structured and unstructured interviews are two different approaches to conducting interviews, each with its own characteristics and purposes. Structured interview. The interviewer follows a predetermined set of questions and a standardized format. That is, it is structured. The questions are typically closed-ended and designed to elicit specific response. The interviewer asks the same set of questions to all the participants, ensuring consistency across the interview. Structured interviews are commonly used when researcher or organization aim to collect quantitative data or compare the responses across participants. This type of interview allows for easier analysis and comparison of responses due to the standardized format. And this type of interview may be more efficient as they typically have a specific time frame and predetermined questions. Next is unstructured interview. The interviewer adopts a flexible approach and does not follow a specific set of questions or a predetermined format. The questions asked during an unstructured interview are open-ended. In structured, it was closed questions and it aims for specific answers. Here, the questions are open-ended. So it allows the participants to provide detailed response and share their perspectives. The interviewer can adapt the questions and probe further based on the participant's answer, allowing for a deeper exploration of the topic. These are often used in qualitative research or when the goal is to gather rich, in-depth information and insights. These interviews are more conversational and can help uncover unexpected or unique perspective and experiences. Unstructured interviews may require more time and effort for analysis because varied responses and lack of a standardized format. It is important to note that there can also be variations between the structured and unstructured interviews. For example, some interviews may use semi-structured approach, which combines elements of both types by having a predefined set of questions while still allowing flexibility for follow-up questions and participant input. The choice between the structured and the unstructured interview depends on the research objectives, the nature of the topic being explored, and the desired depth and consistency of the data collected. Next is observation. It refers to the systematic and objective collection of data through the direct observation of individuals or subjects in their natural environment. It is a fundamental method used to study and analyze behavior, understand patterns, and make inferences about the underlying factors that influence individuals' behavior. For example, the candidate actively listens to the patient, shows empathy and compassion, uses non-technical language to explain medical concept, answer questions patiently, and ensure the patient feels heard and supported. So, this is an example behavior that is observed. In behavioral analysis, observation involves carefully watching and recording the behavior, action, and interaction of individuals or groups. It can be conducted in various settings, such as homes, schools, workplace, or research laboratories, depending on the specific context being studied. Some key aspects of observation in behavioral analysis are naturalistic setting. Observation are often carried out in natural environment where the behavior naturally occurs. This approach allows for studying behavior in real-life context and reduce the impact of artificial or controlled setting. Then observation can be conducted in a structured or unstructured manner. In structured observation, specific behavior or event of interest are predetermined and the observer focuses on recording those particular behavior. But in unstructured observation, it involves a broader examination of the overall behavior without any predefined categories. Then direct observation. Observer directly witness and document the behavior being exhibited. They may use various techniques such as note-taking, video or audio recording, checklist or coding system to accurately capture and document the behavior observed. Observational data can be both quantitative and qualitative. The quantitative data involves numerical measurements, frequencies, or durations of behavior, allowing for statistical analysis. The qualitative data provides rich descriptions, contextual information, and subjective interpretation of behavior and interactions. Then, ensuring the reliability and validity of the observational data is crucial in behavioral analysis. Reliability refers to consistency in observation across different observers or multiple observations by the same observer. Then validity refers to the accuracy and relevance of the data in measuring the intended behavior or construct. The observation in behavioral analysis is often combined with other methods such as interviews, self-report questionnaire, or experimental manipulations to gain a comprehensive understanding of the behavior. Behavioral ratings refer to the systematic evaluation and quantification of behaviors using rating scales or coding system. It involves assigning numerical or categorical score to specific behavior or characteristics based on predefined criteria. Behavioral ratings are commonly used to measure and compare behavior across individuals, groups, or different time points. An example rating is the candidate receives high rating in active listening, empathy, clarity of explanation, and patient-centeredness, indicating the candidate's strong communication skill and ability to effectively interact with the patients. Now let's see some key points about the behavioral ratings. Rating scales are structured tools that provide a set of criteria or dimensions on which behaviors are evaluated. The scales can range from simple to more complex system with multiple dimensions and response options. Coding system involve the development of a specific set of code or categories to describe and quantify behavior. The coders observe and assign codes to behavior based on predetermined guidelines or definitions. Then, behavioral rating can be based on objective or subjective criteria. Objective rating focuses on observable behavior that can be reliably measured by external observer. Subjective rating involves the assessment of internal states, emotions, or subjective experiences reported by the individuals themselves or by knowledgeable informants. The inter-rater reliability. It is a measure of agreement between different raters or observers. It ensures that ratings are consistent and reliable across multiple observers. To establish the inter-rater reliability, multiple observers independently rate the same behavior, and the degree of agreement or consistency among their rating is calculated using statistical measures. Behavioral ratings yield quantitative data that can be analyzed statistically. Researchers can use descriptive statistics to summarize and compare rating across individuals or groups. They can also employ inferential statistics to test the hypothesis, examine the correlations between behaviors and other variables, or analyze the changes in behavior over time or across conditions. The behavioral ratings are widely used in various fields such as psychology, education, and clinical research. They provide a standardized and systematic approach to measure, compare, and analyze behavior. Nomination. It refers to a process where individuals or informants identify or nominate specific individuals or behavior of interest for further analysis or study. It involves the selection or recommendation of individuals who possess certain characteristics or exhibit particular behavior, making them suitable candidates for observation, assessment, or intervention. An example nomination can be: a nurse nominates the candidate based on their excellent communication skill, compassionate approach to the patient care, then ability to build trust, and their success in calming anxious patients. Now let's see some key aspect of nomination. Purpose. Nominations serve as a starting point for identifying individuals or behaviors that are relevant to research or intervention goals. It helps the researcher focus their attention on specific individual or behavior that are of interest or importance in the context of the study. Informant based. Nomination often involve gathering nomination from informants who have direct knowledge or familiarity with the individuals or behavior being studied. The informants can be parents, teachers, peers, supervisors, or other individuals who have regular interaction or close relationship with the individuals in question. Criteria and selection. Nominations can be based on predetermined criteria or guidelines provided to the informants. These criteria may include specific behavior, characteristics, diagnostic criteria, or other relevant factors. The informants nominate individuals who meet the specified criteria, allowing to identify a subset of participants for further analysis. Multiple informants. In some cases, nominations are collected from multiple informants to ensure a comprehensive and reliable selection process. Gathering nomination from different informants, it helps capture different perspectives and reduces the bias or individual difference in perception. Quantitative and qualitative analysis. Nomination data can be analyzed quantitatively or qualitatively depending on the research objective. The quantitative analysis involves counting the frequency or number of nominations received by each individual or behavior, allowing for comparisons and statistical analysis. The qualitative analysis involves examining the specific nominations, identifying patterns, and extracting qualitative insights or themes from the data. Screening and validation. After nominations are collected, further screening or validation process may be conducted to confirm the suitability of selected individuals or behavior. This may involve additional assessment, observation, or diagnostic procedure to ensure the accuracy and appropriateness of the nominations. Nomination is a valuable tool for narrowing down the focus of intervention efforts. It helps identify individuals or behavior that are relevant to specific objective. Situational test. These are assessment tools that simulate real-world scenarios to evaluate an individual's behavioral response and problem-solving abilities. These tests are designed to assess how individuals might behave or react in specific situations, providing insight into behavioral tendencies, decision-making process, and interpersonal skills. The situational tests are commonly used in selection process, such as employee hiring or promotion, or in clinical settings to understand and predict behavior. An example situational test is the candidate is presented with a scenario where a patient expresses concern about a prescribed medication due to potential side effect. The options provided include discussing the benefit and risk of the medication, exploring alternative treatment option, or consulting with a specialist. The candidate selects the response that demonstrates effective communication, addressing the patient's concern and considering their well-being. Now let's see some key features. Simulated scenarios. Situational tests present individuals with hypothetical or realistic situations that they might encounter in their professional or personal lives. These scenarios are designed to be relevant to the specific context or job role being assessed. Standardized format. The situational tests typically have a standardized format ensuring the consistency across different individual or assessment sessions. Behavioral response. Individuals are required to provide their responses or make decisions based on presented scenarios. The response may be in the form of written answer, multiple choice option, or a rating scale. Assessment of skills and competencies. Situational tests aim to evaluate specific skill, competencies, or behavioral dimensions such as problem-solving ability, decision-making skills, interpersonal communication, leadership, or ethical judgment. A realistic context. The scenarios presented in the situational test often reflect realistic work or social situations. Predictive validity. Situational tests have demonstrated predictive validity, meaning that performance on these tests can provide insight into how an individual is likely to behave in similar real-life situations. Role of situational judgment. Situational tests often require individuals to exercise judgment and choose the most appropriate or effective response among the available options. This allows for the assessment of an individual's ability to analyze situation, consider different perspectives, and make sound decisions. The situational tests are a valuable tool for assessing an individual's behavioral competencies and predicting their performance in real-world scenarios. Now let's have a quick recap on what we have learned. In the assessment of personality, we have learned about the behavioral analysis, and the tools used are interview, observation, behavioral ratings, nomination, and situational test. So this is all about the chapter 2, self and personality. We have covered chapter 2 completely. Hope you liked this video, and the upcoming will be chapter 3, meeting life challenges. We'll see you in next video. Please share and subscribe. Thank you and keep smiling.